Well, in the simplest terms, meaningful use is using an electronic health record in a meaningful way. And meaningful use was defined by the ARA Act with essentially three criteria. One is using an EMR in a meaningful way, like e-prescribing or using computerized order entry. Another quality was the exchange of health information. And finally was the submission of clinical quality measures. Well, to qualify for stimulus money, you're going to need to do three things. The first is to use certified EHR technology. The next thing, you're going to need to register through a portal that's going to be provided by Medicare, where you're going to need to submit information to attest that you're using certified EHR technology. Then you're going to submit meaningful use reports. And finally, you're going to need to submit clinical quality measures. Meaningful use reports fit into a broad category of 25 criteria. There are 15 core set of criteria that everybody is going to need to attest to, and then there's a menu set of 10 others. We have information on this on the Waiting Room Solutions website. The 15 core criteria are items like maintaining an allergy list on patients and maintaining an active problem list on patients and obtaining vital signs on patients. And this falls into maintaining it in a certain percentage of patients or simply yes/no answers. The way we're going to handle that in Waiting Room Solutions is we're going to have a meaningful use report area where you're going to be able to get your meaningful use report for a 90-day period, or frankly, a broader period of time. But the critical thing for Medicare will be to be able to submit your report over that 90-day period prior to the reporting period. You're going to be practicing as you've always been practicing. You're going to be paying special attention to the core criteria, such as requiring blood pressure checks on a certain amount of patients. And for those specialists and for those practicing providers or those eligible providers where you may not have been obtaining blood pressures on a certain amount of patients, you probably are going to need to pay more attention to satisfying that criteria. And if you're in a specialty where perhaps you don't prescribe as much, but you're going to need to maintain an active allergy list, you may need to pay more attention to those items to ensure that you meet a minimum threshold to qualify for meaningful use. There'll be reports in WRS that will show you the percentage that each provider has met and all the providers in a practice in aggregate have met to qualify for meaningful use. You're going to need to meet the minimum threshold for, as I already said, the 15 core and 5 out of the 10 menu set criteria. Absolutely. Waiting Room Solutions is ready for meaningful use, and it has been built to be ready for meaningful use. The time frame for registering and then collecting your stimulus money will first start in January of 2011. In January of 2011, they're only going to open the portal at Medicare where you'll first be able to register. After that registration period, which can happen anytime in 2011 or frankly even 2012, prior to September of 2012, you're going to need to report over a 3-month period. In April of 2011, you're going to be able to submit the certification that you're using certified EHR, meeting meaningful use criteria, and submission of clinical quality measures, which means the earliest that you can collect the money for the first year, which is $18,000, will be in May of 2011. That doesn't mean that if you register later, such as June or July or even December of 2011 that you don't have the opportunity to collect on that $18,000. So the topic of a lot of our future emails and newsletters are really going to be about the process and steps required for each provider to collect on the meaningful use money, on the stimulus money. So as developments occur and are put forward from Medicare, we're going to forward that to you.